Good evening, live from this news center of the Sultanate of Oman television. Here we present to you tonight's news bulletin. But first, the headlines. 710 new cases of COVID-19 are recovered and 852 new confirmed cases announced. And the global confirmed infections of the novel coronavirus diseases COVID-19 climbed to reach more than 8.5 million. Good evening once again, and thank you for joining us. Those were the headlines, and now the news in detail. The Minister of Health stressed that 710 new cases of COVID-19 have been recovered today to be 13,974 cases. The ministry announced 852 new confirmed cases, which brings the total number registered in the Sultanate to 27,670, including 125 deaths. Life will come back at Muscat International Airport even after a while, but at the same time, preventive measures will be taken to limit the spread of the virus among travelers. More details in this report. The safety of all at the airport has been given a top priority. Although the air traffic of Muscat International Airport has been impacted by the pandemic of COVID-19, the Oman Airport company spare no efforts in ensuring that the airport remains safe all the time, as there are flights scheduled at times to pick up passengers stranded to return to their homes. Hence, the safety and well-being of airport staff and passengers has been given special attention.
Oman airports pay great attention to the health and safety of employees, workers, contractors in the aviation sector, as well as the passengers traveling via Muscat International Airport. All facilities at Muscat International Airport subject to many preventive measures to limit the spread of the virus in the community. All facilities at Muscat International Airport will be subject to many preventive measures in order to limit the spread of the virus in the airport community, according to the requirements and recommendations set by Public Authority for Civil Aviation in cooperation with the Ministry of Health. All these preventive measures will be applied in all airports managed by Oman Airports.
Complete disinfection and sanitizing procedures is being implemented continuously to reduce the risk of COVID-19 infection spreading amongst passengers and airport staff. Luggage trolleys enter the sterilizing devices as a precaution against the virus. Passengers passes through personal sanitizing devices before entering airport terminals, and the airport entry procedures have strengthened its system to protect travelers from the infection, where specific gates are open to ensure the entry and exit flow, and specific paths are used to organize the physical distance, as the airport has placed instructions posters of social distancing inside the terminals.
This is to ensure that Oman Air is super ready to operate under a COVID compliant environment. The new set of regulations will be a little different than you are used to as a traditional travel. We will be having a declaration form that you need to fill in at a booking stage, and ensure that that is with you when you come in for check-in. The aircraft will be left with some isolation area in the event anybody develops symptoms, and all the regulations have been incorporated to make sure that we are among the best airlines that are operating under a COVID compliant environment.
Passengers are required to fill up specific forms on their arrival, where the airport healthcare staff will clarify their health status and give them instructions accordingly.
Uniform Echo left Victor holding point, requesting Yankee 3 for departure Express India 155.
We as tower controllers in Muscat Tower, following the most important measurement of precaution to stay safe and healthy.
Life will come back at Muscat International Airport even after a while, but at the same time, preventive measures will be continued to limit the spread of the virus among travelers. Indeed, the precautionary measures taken by Oman airports is very well followed here to prevent the transmission of COVID-19. For the Sultanate of Oman television, I'm Abdullah bin Ahmed Al-Rubai, Muscat Tower, Muscat International Airport.
Non-compliance with the directives of the Supreme Committee dealing with coronavirus COVID-19 exposes you to risk and legal action. Stay safe.
A coronavirus vaccine candidate China is developing may not be ready for sale until at least 2021 as researchers struggle to move into large-scale human trials in the country because of a lack of new infections. More than 10 experimental vaccines are being tested in humans globally as scientists race to protect against the novel coronavirus that has killed more than 450,000 people. But none of them has yet passed late-stage phase 3 trials that require thousands of participants to determine a vaccine candidate's effectiveness. China, where the virus first originated last year, saw less than 10 new local cases reported daily on average in May, making it less favorable for a late-stage clinical trial. China National Biotech Group's vice president said they can launch more international cooperation and conduct a multiple center phase 3 clinical study to help bring the vaccine to the market. A new outbreak in the capital Beijing city last week has infected more than 180 people, but the number of new patients compared with the population was still too low to make it an ideal trial site. According to the report from the World Health Organization, WHO, the global confirmed infections of the novel coronavirus disease, COVID-19, climbed to reach more than 8.5 million. The total fatality worldwide stood at 445,535. The number of COVID-19 cases in the U.S. reached 2.19 million, and the death toll of COVID-19 rose to 118,381. On Tuesday, 9 states has reportedly either new single-day highs or set a record for 7-day new cases averages. They are Alabama, Arizona, Florida, Nevada, North Carolina, Oklahoma, Oregon, South Carolina, and Texas. New York Governor Andrew Cuomo blamed the White House's reopening policy for the resurgence of COVID-19 infections. Brazil's total death toll reached to nearly 48,000. The United Kingdom reported a total of 300,469 infections. Beijing residents were trying to stay optimistic today during a second wave of the coronavirus that has resulted in more than 180 cases in the capital in 8 days, linked to the sprawling Sinfani wholesale food center in the city's southwest. There were long queues outside grocery stores, and freezers with the seafood were sealed off. Officials said that the meat and seafood trading sections in the Sinfani market were severely contaminated with the virus. Today, a researcher with the Chinese Center for Diseases Control and Prevention said the organization was working to test people in key regions and industries in an effort to track down as many cases as possible. A National Health Institute study of wastewater has found that the coronavirus was already present in 2 large cities in northern Italy in December, over 2 months before first case was detected. This suggests the virus appeared in Italy around the same time it was first reported in China. Researchers discovered genetic traces of SARS-CoV-2 as the virus is officially known in samples of wastewater collected in Milan and Turin at the end of last year. Italy's first known native case was discovered mid-February. The results feed into an effort by scientists around the world to trace the virus family tree. You're watching the Sultanate of Oman television, and yet to come in our news bulletin. The Sultanate will witness next Sunday the annular solar eclipse. Back to work is a step of hope for the best to come. Here are the instructions that will protect you from coronavirus. Wear masks while leaving your house by following proper procedures. Keep a physical distance of at least 2 meters away from others. Follow the main hygienic procedures of washing or sanitizing hands from time to time. Avoid using elevators as much as possible, and if you have to use it, ensure less number of people to guarantee physical distance from one another. Gatherings at entrances, waiting rooms, offices, meeting halls, and prayer places are forbidden. If you have any symptoms of the disease, immediately contact the bodies concerned specified by the Ministry of Health. By adhering to these instructions, it will assist you in preventing from contracting the COVID-19. A new hope for Oman is indeed in our hands. Stay safe. You're watching the Sultanate of Oman television, and here we continue the news. The board of the United Nations Atomic Watchdog Agency today adopted a resolution calling for Iran to provide inspectors access to sites where the country is thought to have stored or used undeclared nuclear material. Mikhail Ulyanov, Russia's ambassador to international organizations in Vienna, said that his country and China had voted against the resolution that Germany, France and Britain proposed at a meeting of the International Atomic Energy Agency board. Ulyanov said they believe that the resolution can be counterproductive, while also stressing the need for Tehran and IAEA to settle this problem without delay. The foreign ministers of Germany, France and Britain are meeting in Berlin for talks in Iran and other issues. Iran Foreign Minister Mohammad Javad Zarif tweeted that an agreeable solution is possible for the United Nations Nuclear Watchdog's request for access to 2 nuclear sites in the country. France, Britain and Germany, all parties to Iran's nuclear deal with major powers, have submitted a draft resolution to the International Atomic Energy Agency's Boards of Governors, calling on Iran to stop denying the agency access to 2 old sites and to cooperate fully with it. If the IAEA resolution is passed, it would raise pressure on Iran to let inspectors into the 2 sites where the IAEA suspect activities potentially related to developing nuclear weapons were carried out in the early 2000s, long before the deal. Indian forces have killed 8 militants in Restive, Kashmir, including 2 who hid in a mosque as New Delhi escalates counter-insurgency efforts in the disputed territory. The new fatalities following gun battles yesterday and Friday take the death toll of alleged militants over 100 this year. Indian-administered Kashmir has been in turmoil since last August, when New Delhi revoked its semi-autonomous status and imposed a communications blackout that has not been fully lifted. One gun battle at Nij in the main city of Srinagar led to the death of 1 militant and a night-long standoff with 2 others who hid inside a mosque. Security forces used tear smoke shells and later neutralized the 2 security forces. Also killed 5 militants who hid in an underground shelter in an apple orchard in Shopping district. The shootouts have also sparked clashes between government forces and villagers who support the militants. Oman Oil price August delivery reached today $43.82 per barrel, increasing by $1.68. The average price of Oman Oil July delivery reached $83.68 per barrel, increasing by $10.03 compared to the price of June delivery. In line with the preparedness of the Minister of Health to tackle COVID-19, the Directorate General of Health Services of Dakhliya Governorate DGHS Dakhliya developed plans to deal with this pandemic with taking all required procedures and continues to move as required. More details in the following report. From the time the pandemic of COVID-19 entered the Sultanate, the healthcare institutions in the country made all the preparation to tackle coronavirus. Here at the Directorate General of Health Services at Dakhiliya Governorate, they developed plans to deal with this pandemic, taking all required procedures. Committees and subcommittee of emergency management prepared all health institutions in the governorate, ensured the readiness of health workers, as well as provided them with the medical supplies and personal protective equipment. In addition, a special path has been determined to deal with the suspected cases. The subcommittee, which is headed by Dr. Ali Al-Dhawi, Director General, has been in permanent session to follow up all developments of the COVID-19 pandemic. A number of awareness campaigns on the pandemic prevention and control through the social media channels, videos or leaflets have been distributed in the public areas, along with allocating a hotline for all queries regarding the COVID-19 pandemic. An epidemiological investigation team has been formed in all wilayats of the governorates to investigate the sources of the suspected cases, account the contacts, and clarify the procedures of the home isolation. The Directorate expanded the COVID-19 examinations by providing the examination in most health institutions of the governorate in order to facilitate the movement of the clients. In cooperation with the relief and shelter sector in the governorate and other concerned public and civil authorities, a number of centers for institutional isolation, hotels and hotel apartments have been allocated for the infected or suspected cases. These centers have been provided with prevention needs and psychological counseling services, along with the following up the isolated persons in these institutions. As for the infected persons and the self-isolated contacts, the health teams of the governorate contacting them and visiting them whenever required to monitor their health. A plan in place has been developed to allocate a fully equipped field hospital if necessary, in coordination with the relief and shelter sector and other governmental authorities. Furthermore, an emergency room has been activated in the governorate to respond to all inquiries received from the Emergency Management Center of the Ministry of Health and coordinate with the military and civil sectors to tackle this pandemic. High authorities in the Ministry of Health has visited the governorate and praised the efforts of the medical staff, allied health categories and the administrators in various healthcare institutions, stressing the need for raising awareness between the health workers in their specialties regarding prevention of COVID-19 infections, with the necessity of implementing the ways to reduce the spread of the disease in the health institutions among the health care workers. Abdullah bin Ahmed Al-Rabi'i, Sultanate of Oman Television. In a rare astronomical phenomena, the sky of the Sultanate will witness next Sunday, the 21st of June, the annular solar eclipse. An annular solar eclipse happens when the moon covers the sun's center, leaving the sun's visible outer edge to form a ring of fire or annulus around the moon. This occurs when the sun, moon and earth are aligned. The Sultanate's sky in its various governorates will observe these phenomena for 3 hours and 6 minutes. It can be seen through using safe and suitable tools starting from 8:14 a.m. and it reached its peak at 9:38 a.m. Many photographers are waiting to record this rare and amazing phenomena. Oman Astronomical Society urged citizens and residents to avoid looking at the sun when observing this rare astronomical event without using safe solar eclipse glasses specialized and approved for this purpose. Without proper eye protection like eclipse glasses, the sun's rays can burn the retinas in the eyes, leading to permanent damage or even blindness. You're watching the Sultanate of Oman Television, and to end this news bulletin, here are the main points once again. 710 new cases of COVID-19 are recorded and 852 new confirmed cases announced. The global confirmed infections of the novel coronavirus disease COVID-19 climbed to reach more than 8.5 million. And with that, we do conclude the